everyone, Jessica Simonis, practitioner at the Psoriasis Eczema Clinic, and back with part 2 in our nutrition and skin series. So today we're asking the question, should I avoid dairy? Now, with the growing evidence supporting the link between diet and skin disease, many of us are searching for that one food or that culprit that might hold the key to clearer skin. Dairy foods, including milk, cheese, cream and yogurt, often get a really bad rap and are often the first food group to be eliminated next to wheat. But what is the evidence? So, with eczema, there is evidence to support a link between dairy and eczema in the form of food allergy. Now, food allergies are more common in eczema patients that are under the age of 3. So roughly about 10% of eczema patients will have a food allergy. Now, it's not the cause of the eczema, but it is a aggravating factor or a triggering factor for eczema. So if you're an adult or if you're older age, it's less and less likely that food will actually be playing a role as an allergen in your particular condition. So there are ways of finding out if it's possible that you have an allergy to dairy, and these include allergy testing, skin prick testing and blood testing. Again, as you get older, it's less and less likely to be the case unless you have symptoms of other issues with dairy, such as food intolerance or lactose intolerance. So food intolerance is not a cause of eczema, but again, it can be a trigger. So every time you have a reaction, it can actually trigger off the eczema as well. Again, there are ways of testing for food intolerance issues, and it can be helpful to seek some professional advice with this. With acne, there has also been found to be a link between dairy and acne, and the way that it affects acne skin is that it increases something known as insulin growth-like factor, and this has been shown to increase the rate of sebum production, which then leads to clogged pores and a build-up and accumulation of matter in the pores, which leads to inflammation and pimple lesions. So there has been a link there, and some acne patients can find that reducing dairy in their diet can make a difference with their skin. With psoriasis, there's not as much evidence to support this link, but again, if you have an existing allergy to dairy that has been confirmed, or you have an intolerance to dairy, you might find that it is still connected and linked to aggravation of your symptoms. Not a cause, but it can be an aggravating factor. So again, if you find that you eat dairy, that you have digestive symptoms, or you notice your skin worsens, then it still might be worth cutting back, or sometimes coming off, or at least having it confirmed that there is an intolerance or an allergen going on underneath. But it's certainly not the case for everyone, definitely on an individual basis. So if you are concerned whether dairy is right for you, or whether you may have a food allergen or an intolerance that is affecting your skin, definitely recommend getting some professional guidance where your practitioner can help you with a very structured elimination re-challenge protocol. So that concludes today, and we'll see you next time for part 3 in our nutrition and skin series. Thanks.